Hi, so we are group 8 and we are doing the sternoclavicular joint, or also called the SC joint. My name is Aubrey.
My name is Michael.
I'm Luke.
And then Anna is also here, but she is currently behind the camera, so she will come in later. Alright, so some facts about the SC joints. This is one of 4 joints that form the shoulder complex. This also is an articulation formed by the clavicle and the manubrium of the sternum. So this is going to be the manubrium of the sternum, and this is going to be the clavicle. So this is talking about this joint right here. This is also a plane style synovial joint, and it has 3 total degrees of movement. So the first one is going to be elevation and depression, and this is elevating and then depressing. This occurs in the frontal plane about an anterior-posterior axis. So the second one is going to be protraction and retraction. So protraction is this, and then retraction is this. It occurs in a transverse plane about a vertical axis. And then the last one is going to be axial rotation. So this is going to be in the movement of flexion, but it occurs at the end of flexion. Because the clavicle slightly rolls posteriorly, that occurs in the sagittal plane about a medial lateral axis.
So the next part we're going to do is function and support of this joint. So one of its major functions is supports and controls movement in the sternoclavicular joint, because there's little bony stability around there, so most of the stability comes from the ligaments right here. And it's very infrequently dislocated, so the fracture of the clavicle is much more common than dislocation. And we see it in a posterior dislocation. It is a medical emergency. It's just right around here, because there's a lot of sensitive structures around there, like the trachea and the esophagus, and important vessels.
So like Michael said, there isn't very much bony stability in the sternoclavicular joint, and so most of the stability comes from the ligaments, and it also comes from the sternoclavicular disc. So the sternoclavicular disc is going to be right about here, and what that does is it deepens the articulation between the sternum and the clavicle, and so that just allows for a little bit extra support. It also absorbs any forces that are transmitted onto the clavicle. So then there's 4 main ligaments of the sternoclavicular joint. The first one is the anterior sternoclavicular ligament, which is going to be right here. Then we have the posterior sternoclavicular ligament, which you can't really see, but it's going to be like right behind the clavicle. Then we have the costoclavicular ligament, which is over to the side right here, and the interclavicular ligament, which runs in the middle right here. And so the anterior sternoclavicular ligament strengthens the joint anteriorly, and so it doesn't allow the clavicle to push forward. The posterior sternoclavicular ligament does the exact opposite, so it strengthens the joint posteriorly, so it doesn't allow the clavicle to move posteriorly. The costoclavicular ligament resists elevation of the pectoral girdle, and the interclavicular ligament reinforces the joint capsule posteriorly. So the ligament structures in this joint are very strong, which is why you often get fractures of the clavicle before a dislocation of the sternoclavicular joint. And there are also no muscles that attach directly to the sternoclavicular joint.
So a little bit about injuries that can occur in and around the sternoclavicular joint. The sternoclavicular joint can be damaged over time as the protective tissues that cover the end of the manubrium and the end of the clavicle can wear away. And this type of degenerative change in the joint can lead to pain, stiffness, and a reduced motion within the arm and shoulder joints. The costoclavicular ligament is the main limitation to movement and therefore the main stabilizer of the joint. And this, along with the fibrocartilaginous joint disc, increase range of motion, and injuries or degradation of either of these tissues can lead to, again, pain and reduced motion within the shoulder. The joint capsule consists of a fibrous outer layer with an inner synovial membrane, and this membrane produces synovial fluid to help reduce friction between the articulating surfaces of the joint. The neurovascular supply for the structures around the sternoclavicular joint include the subclavian nerve and subclavian artery. And as we learned, compression of the subclavian space can impede the signals that come through these and the blood flow and cause more issues and pain with the joint. The costoclavicular ligament acts as a pivot for movements of the clavicle, and this is one that you can feel when palpating the sternal end of the clavicle and shrugging your shoulders, and you should feel the sternal end of the clavicle moving inferiorly. And now just a little bit about arthrokinematics and osteokinematics of the sternoclavicular joint. So when you perform an action like elevation of the scapula, you will have a superior roll and an inferior glide of the sternal end of the clavicle within the sternoclavicular joint, and you would then have the opposite motion during depression.
And that is, I can't see you.
I don't
That's our presentation.